Which of the following symptoms is most indicative of a pulmonary embolism? A. Chest pain. B. Constipation. C. Polyuria. D. Joint pain. The correct answer is A. Chest pain. Rationale: chest pain is a common symptom of a pulmonary embolism due to obstruction of blood flow in the pulmonary arteries. What is the priority nursing intervention for a client experiencing anaphylaxis? A. Administering an antihistamine. B. Applying a warm compress. C. Providing emotional support. D. Administering epinephrine. The correct answer is D. Administering epinephrine. Rationale: epinephrine is the first-line treatment for anaphylaxis as it helps reverse severe allergic reactions rapidly. Which of the following assessment findings should the nurse prioritize in a client with suspected appendicitis? A. Bradycardia. B. Right lower quadrant tenderness. C. Decreased bowel sounds. D. Hypertension. The correct answer is B. Right lower quadrant tenderness. Rationale: right lower quadrant tenderness is a classic sign of appendicitis and requires immediate attention. What is the priority action for the nurse to take when caring for a client with a potassium level of 6.2 milliequivalent/L? A. Administer potassium supplements. B. Encourage a high potassium diet. C. Monitor cardiac rhythm. D. Administer calcium gluconate. The correct answer is C. Monitor cardiac rhythm. Rationale: hyperkalemia can lead to life-threatening cardiac dysrhythmias, so monitoring the cardiac rhythm is essential. Which of the following interventions is most appropriate for a client with a Glasgow Coma Scale score of 8? A. Administering a sedative. B. Elevating the head of the bed. C. Performing a neurological assessment every hour. D. Providing a clear liquid diet. The correct answer is C. Performing a neurological assessment every hour. Rationale: clients with a Glasgow Coma Scale score of 8 or less are at risk for neurological deterioration and require frequent assessments to detect changes. What is the priority action for the nurse to take when caring for a client experiencing serotonin syndrome? A. Administering a beta blocker. B. Increasing serotonin-rich foods in the diet. C. Administering cyproheptadine. D. Administering a selective serotonin reuptake inhibitor. The correct answer is C. Administering cyproheptadine. Rationale: cyproheptadine is a serotonin antagonist and can help reverse the symptoms of serotonin syndrome. Which of the following findings should the nurse anticipate in a client with severe hypothyroidism? A. Bradycardia. B. Weight loss. C. Diaphoresis. D. Hyperactivity. The correct answer is A. Bradycardia. Rationale: severe hypothyroidism can lead to bradycardia due to decreased metabolic rate and decreased sympathetic activity. What is the priority nursing intervention for a client experiencing a hypertensive crisis? A. Administering a diuretic. B. Providing emotional support. C. Administering antihypertensive medication as prescribed. D. Encouraging the client to relax and breathe deeply. The correct answer is C. Administering antihypertensive medication as prescribed. Rationale: immediate reduction of blood pressure is crucial in hypertensive crises to prevent end organ damage. Which of the following findings indicates a potential complication of peritoneal dialysis? A. Hypotension. B. Pink-tinge drainage. C. Cloudy peritoneal effluent. D. Tachycardia. The correct answer is C. Cloudy peritoneal effluent. Rationale: cloudy peritoneal effluent may indicate infection or peritonitis, a serious complication of peritoneal dialysis. What is the priority nursing intervention for a client with a suspected tension pneumothorax? A. Administering oxygen. B. Administering pain medication. C. Preparing for chest tube insertion. D. Positioning the client in a high Fowler's position. The correct answer is C. Preparing for chest tube insertion. Rationale: tension pneumothorax requires immediate intervention with chest tube insertion to relieve pressure on the affected lung. Which of the following actions should the nurse prioritize when caring for a client with suspected carbon monoxide poisoning? A. Administering oxygen therapy. B. Providing intravenous fluids. C. Applying a warm blanket. D. Encouraging deep breathing exercises. The correct answer is A. Administering oxygen therapy. Rationale: administering oxygen therapy helps to displace carbon monoxide from hemoglobin and improve oxygenation. What is the priority nursing intervention for a client experiencing a seizure? A. Placing a padded tongue depressor in the mouth. B. Restraining the client's limbs. C. Protecting the client from injury. D. Administering an antipsychotic medication. The correct answer is C. Protecting the client from injury. Rationale: the priority during a seizure is to ensure the client's safety by protecting them from injury. Which of the following interventions is most appropriate for a client with a suspected myocardial infarction? A. Administering aspirin. B. Applying a cold pack to the chest. C. Encouraging deep breathing exercises. D. Providing a high-fat diet. The correct answer is A. Administering aspirin. Rationale: aspirin helps prevent further clot formation and is a standard treatment for myocardial infarction. What is the priority nursing intervention for a client receiving a blood transfusion who suddenly develops shortness of breath and chest pain? A. Administering pain medication. B. Slowing down the blood transfusion rate. C. Discontinuing the blood transfusion. D. Encouraging the client to take deep breaths. The correct answer is C. Discontinuing the blood transfusion. Rationale: shortness of breath and chest pain during a blood transfusion may indicate a transfusion reaction, and the transfusion should be stopped immediately. Which of the following actions should the nurse take first when caring for a client with diabetic ketoacidosis (DKA? A. Administering insulin. B. Checking blood glucose levels. C. Administering intravenous fluids. D. Monitoring electrolyte levels. The correct answer is C. Administering intravenous fluids. Rationale: rehydration with intravenous fluids is the first step in managing decay to correct dehydration and electrolyte imbalances. What is the priority nursing intervention for a client with a nasogastric (NG) tube experiencing respiratory distress? A. Elevating the head of the bed. B. Suctioning the NG tube. C. Administering pain medication. D. Administering a bronchodilator. The correct answer is A. Elevating the head of the bed. Rationale: elevating the head of the bed helps prevent aspiration and can improve respiratory distress in clients with NG tubes. Which of the following interventions should the nurse prioritize when caring for a client with a new colostomy? A. Applying a transparent dressing over the stoma. B. Teaching the client how to change the ostomy appliance. C. Administering an antidiarrheal medication. D. Encouraging the client to avoid eating high-fiber foods. The correct answer is B. Teaching the client how to change the ostomy appliance. Rationale: education about ostomy care is essential for client independence and prevention of complications. What is the priority nursing intervention for a client with suspected internal bleeding? A. Administering a stool softener. B. Monitoring vital signs frequently. C. Providing emotional support. D. Applying a warm compress to the abdomen. The correct answer is B. Monitoring vital signs frequently. Rationale: monitoring vital signs can help detect changes indicating worsening internal bleeding and guide prompt intervention. Which of the following findings should the nurse prioritize when assessing a client with suspected septic shock? A. Hypertension. B. Bradycardia. C. Hypothermia. D. Decreased urine output. The correct answer is D. Decreased urine output. Rationale: decreased urine output is a hallmark sign of inadequate tissue perfusion and organ dysfunction in septic shock. What is the priority nursing intervention for a client experiencing an acute asthma exacerbation? A. Administering a beta blocker. B. Encouraging deep breathing exercises. C. Administering oxygen therapy. D. Administering a bronchodilator. The correct answer is D. Administering a bronchodilator. Rationale: bronchodilators help relieve bronchospasm and improve airflow in acute asthma exacerbations. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of tuberculosis (TB)? A. Administering a flu vaccine. B. Placing the client in a negative pressure room. C. Encouraging frequent hand washing. D. Administering intravenous antibiotics. The correct answer is B. Placing the client in a negative pressure room. Rationale: placing the client in a negative pressure room helps prevent the spread of TB to others. What is the priority nursing intervention for a client with a spinal cord injury at the level of C4? A. Administering corticosteroids. B. Assessing respiratory status. C. Administering a laxative. D. Providing emotional support. The correct answer is B. Assessing respiratory status. Rationale: clients with spinal cord injuries at the level of C4 or above are at risk for impaired respiratory function and require immediate assessment. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of deep vein thrombosis (DVT? A. Applying heat to the affected leg. B. Encouraging frequent ambulation. C. Administering anticoagulant therapy. D. Elevating the affected leg. The correct answer is C. Administering anticoagulant therapy. Rationale: anticoagulant therapy is essential for preventing further clot formation and complications in clients with DVT. What is the priority nursing intervention for a client with suspected meningitis? A. Administering a stool softener. B. Encouraging the client to rest. C. Administering intravenous antibiotics. D. Providing a low-sodium diet. The correct answer is C. Administering intravenous antibiotics. Rationale: prompt administration of antibiotics is crucial in treating bacterial meningitis and preventing serious complications. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of rheumatoid arthritis (RA? A. Applying cold packs to inflamed joints. B. Encouraging weight-bearing exercises. C. Administering disease-modifying antirheumatic drugs (MARDs). D. Administering high-dose corticosteroids. The correct answer is C. Administering disease-modifying antirheumatic drugs (MARDs).